Our first question and our first call is from Tara in Sunnyside. Are we able to patch Tara through?
Yes. Hey, how you doing? This is Tara Devlin. I live in Sunnyside. Okay. I think there's a delay. Are you there?
Yeah, there's a little lag, but
all right.
Great to hear from you. Thank you so much for calling in.
Thank you. Okay, well, what I wanted to talk about is I appreciate everything you're saying about how the inequities are completely exposed right now, that the coronavirus has really pulled the cover off of what is a major problem in this country, which is we are now the least upwardly mobile of all of our Western partners. The United States in 40 years went from the most to the least upwardly mobile with the widest income gap. And we're the only country that doesn't guarantee healthcare as a right of citizenship and all the other things that the progressives talk about. Because the thing that really that frustrates me when I was for Bernie, and I'm also a big supporter of yours. But what we need to do, in my opinion, is to frame all of what, for example, Medicare for all. We need to frame these progressive initiatives as the patriotic imperatives that they are. It's not just a nice thing to do. It's not just the moral thing to do, but they are necessary to maintain a functioning democracy. We don't leave anybody behind. Mm-hmm. It is just like we don't leave people behind on the battlefield. We don't leave them behind in sickness or in ignorance, let's say, for higher education or living wages. We don't leave them behind without housing, without opportunities. And this is really the bottom line, because, the entire United States is the U.S. itself is a progressive initiative. Mm-hmm. You know what I mean? We said we don't need a king and an aristocracy. There was nothing more progressive going on in the world at that time than what we're doing here. And I'm afraid that we're losing democracy. We're losing the grand experiment because of all the upward immobility and income disparity. You can't have, like Justice Louis Brandeis said, you can't have democracy. You have to make a choice. It's democracy or concentrated wealth, but you can't have both. And I'm afraid that if we move past this time and we don't really seize the opportunity to change it, we're never going to have an opportunity to really fix what needs to be fixed. And it's not just like I'm saying. I wish that you guys, like with Bernie, it was frustrating listening to Bernie debate the other Democrats, because it's really, we're on the right side of history and the right side of democracy. It's about saving democracy as a patriotic imperative. And I think that's something that conservatives can also connect with if you frame it in that kind of way, as a patriotic thing that must be done.
Yeah. So, and anyway. Tara, I think you bring up a really, really smart point, because I think you're approaching this as a real organizer, right? Which is that people respond mm-hmm. to all these different frames, right? And
right.
You're going to have to make the argument for the same policy, the same conclusion in 10 different ways sometimes to get 10 different people on board. And we need to right. be able to talk about these things, because you know what, for some people, the morality frame is what wins them over, right? For some people, it's like, okay, mm-hmm. yes, there's the patriotic thing to do, but I want to do it because it's the right thing to do. And for other people, it's vice versa.
Right.
Other people, it's like, okay, bleeding heart liberal, whatever.
Right.
But
right.
I want to support this because it's good for our country. And I think
right.
you're totally right in that we're going to have to really start getting good at being able to argue for this policy in a lot of different ways, not just the same way, in order to reach out to a lot of people. Because, one of I think the big blessings that I had in my experience with Bernie is that it was my first time going to places like Iowa. It was my first time going to communities like this in Nevada. And, I think we all know intrinsically that that this is good for all of us, but having the experience of being able to go out with farmers and go out in communities that I've never been in my whole life, it's only reinforced this idea that, man, it doesn't matter how different we are. This is really critical for every single one of us. And we may be experiencing all of these things in different ways. I experience it, you experience it, we experience it as New York City residents, as outer borough residents. But even though we have a certain cultural experience, like we're all experiencing the same reality sometimes through different cultural lenses. And there's nothing wrong. I think there's nothing wrong with leaning into that. And, what is like the Midwest spin on Medicare for all? What is the New York City spin on Medicare for all? And, and I think you're totally right about that. And there is a patriotic argument for it because
absolutely,
all of this is I think a patriotic act, because for once we're trying to return power in this country back to voters and the everyday people, the citizens, residents that make it up. So I think you're totally right. And that's also up to each and every one of us, right? Because you and I, we have, I think the most powerful thing that we have is the power of our intimate relationships, right? It's, you can get through to your cousin or to a niece or to a nephew that in 99% of situations would tune out the argument. But because it's you and because they care about you, they'll give you a shot and you can win them over. And I think it's important to also reiterate that it takes many conversations, right? It's not a magic, like you're not going to debate your coworker one day and change their mind in one conversation. We kind of like chip at it, but we got to keep at it. And I think we can get there. And I think, using recommendations like yours are really smart, and that's how we do it.
Yes. And could I just make one more point? It's sort of like with FDR and Social Security. FDR created Social Security to belong to all of us. That's another thing that drives me insane about the Democrats, because they're very good at throwing subsidies at everything. But in my opinion, those subsidies, they're great. It helps. But those subsidies actually subsidize the broken system. They don't ultimately subsidize the people. And it keeps people divided. So somebody who gets, a subsidy for college, let's say, I know this, I experienced this in my own life. My family, my sister has 3 kids and they're going to college, and she, she is not rich, but she makes more than $125,000. So she doesn't get, her and her husband, she doesn't get anything. And so I've heard it in her own mouth say, oh, well, they get everything. And that's how they keep us divided.
Absolutely.
So that's why, it's like everybody in, nobody out. That's why they, FDR created Social Security to belong to everyone, because it is a unifying program. And you notice how how many years Republicans have been trying to privatize it, they haven't been successful yet, because it belongs to everybody.
100%. And that's just like
I believe,
Sorry, no, just like you said, that's the value of a universal system, because you're right.
Exactly.
When we do these like means testing and draw these arbitrary lines, it never acknowledges the actual local reality, right? Which is, you're saying this is your sister or your sister-in-law? Okay, you might have been muted, but you're talking about, a loved one of yours that feels this way because they're making 100, maybe 125, or maybe around there. Yeah, because in New York City, that is not a lot of money. But if you float that number to anyone outside of New York City or anyone outside of the state of New York, or people in a more rural area, they'll say, oh, she's rich. And then meanwhile, you've got people that are living a very middle class lifestyle on those funds, and looking at those other folks and saying, well, they're getting everything. Why am I paying for this? And so the virtue of universal systems is if you want it, it's there for you, and that allows us to really kind of come together on it. So I think you're totally right. That's why universal systems are important, because when you start drawing these lines, then it takes forever to change them, and it creates artificial dividing lines. Just look at this stimulus check, for example. It's people making less than 75K get this one-time check for $1,200, but that neglects the fact that this is a completely arbitrary number that is being treated the same for people across the entire country. It neglects cost of living. It neglects the realities that we have, which is one of the reasons why I think means testing ultimately ends up to be this kind of failed experiment, because 125 in New York City is, for a family, is a completely different reality. It's probably equal to 60K or 70K of what another person's lived experience may be in a different part of the country. And so instead of, the irony of that is now it sets up this fight where people making $40,000 a year are fighting against people making $120,000 a year, when the real issue are the people that are making millions of dollars a minute without paying taxes and helping fund our universal systems. And so when we fight over what line this is, it's one that feeds into this myth where middle-class people are where we think if you're making 100K or 100, 150K, that you are like part of this same rich elite class of people as people who are making millions, if not billions of dollars. And so it does matter. And I think the universality of our systems do matter. And in what you're talking about with Social Security is absolutely a key example. Same thing with Medicare. There is a reason why Social Security and Medicare are treated as sacred cows in politics. Republicans try to cut them as much as they can. They have to do it through these backdoor sneaky ways because they know that it is politically unpopular for no matter what your party is, to come out and say, we don't want Social Security anymore and we don't want Medicare anymore. And that's because of the universality of these systems. And when we talk about healthcare, especially, which we're going to have Congresswoman Jayapal pop in just a moment to talk about it. When we talk about Medicare specifically, and Medicare is a universal program based on age. So it is available to you the moment you turn 65. Obviously, it's not universal for everybody, but once you turn 65, it is essentially a universal program for people that age and older. And what do we see? We see that life expectancy and healthcare outcomes in the United States are, compared to our counterparts before the age of 65, what do we see? Much worse. But then something funny happens in those projections, which is once a person turns 65, your health outcomes, expectancy, all of that, all of your health, a lot of major health indicators start to skyrocket and look really, really good. And there's just a switch that gets flicked in some of these statistics from 64 or 63 to 65 and 66. And that switch is Medicare. And what we really need to do, and that's why, advocating for a Medicare for all system is so incredibly important. And when you talk about arguing for subsidies, You're totally right about that. One of the things that some Democrats were trying to float in this COVID crisis is subsidizing the insurance companies that were, the health insurance companies that are experiencing a lot of costs right now, but not doing anything to actually cover people's actual healthcare expenses. So we're talking about a health insurer bailout, a corporate bailout to help the insurers, but we're not even talking about lowering Medicare eligibility requirements, lowering the age of Medicare, or expanding coverage in substantive ways. And so instead of subsidizing and bailing out the folks that are contributing to the problem crisis after crisis, then maybe we should actually address the core systems that are working.